Καλησπέρα σας. Καλημέρα σας μάλλον. Θα ήθελα να περάσουμε στην επόμενη συνεδρία και επειδή έχουμε και την κυρία Magahy, θα συνεχίσω στα αγγλικά. It's a great honor to introduce Laura Magahy. Laura, good morning.
Morning.
Mrs. Magahy is the Executive Director of the Sláintecare Program Implementation Office, and Slintecare is known to be an exciting health reform program in Ireland. Previously, Mrs. Magahy has led some of Ireland's most significant transformational public sector projects on behalf of the Irish government. She's also a fellow and past president, if I'm not mistaken, of the Institute of Directors, and she's one of Ireland's top level A project directors. She's an honorary member of the Royal Institute of Health Architects in Ireland and has served in numerous public, private boards as chairman, non-executive director and executive director. Ms. Magahy will present today the 10-year program to transform health and social services for the Irish people. And without further ado, please allow me to pass the floor to Mrs. Magahy to present this exciting presentation. The floor is yours.
Thank you so much. And thank you to everybody for inviting us here today. Can you see my slides okay?
Not yet.
Not yet. Share screen. So is that good?
Yes, absolutely.
Fantastic. So listen, it's wonderful to be joining you here from Dublin, where we have a grey day. I hope it is nicer in where everybody is, but it is an honour to be with you here today to talk about our 10-year programme to transform the health and social care services for the Irish people. So the background to this is that over the next 10 years, Ireland's demographic is changing dramatically, and we are going to have a much larger population and a much larger population who are going to be over 65. So that creates demand on our services right across the system, from inpatients increasing, daycare activity, outpatients, home care and nursing home places. We also have a significant backlog of waiting lists, people waiting for many weeks and months for their operations, and this has led us to look at what capacity we would require over the next number of years. And if we did nothing to transform our health services, we would have a requirement by 2031. So our bubble on the left-hand side, the red bubble, which shows a projected demand of more than 7,000 acute beds and a huge number of primary care workers. And therefore we need reform in order to move care from hospitals into the community and to transform our services under 3 pillars. So we have a healthy living pillar, enhanced community care and hospital productivity. And this means that we are going to have to put in place extra bed capacity, but also shift our care from hospital to community and build up capacity and change the way that we are doing things. And the background to this and what has meant that it is a really, I suppose, an initiative that has cross-government support, which is really important as different politicians come into being. This has been an agreed position between the politicians. So it originated from an all-party parliamentary committee on the future of healthcare in 2017. Our implementation office opened 2 years ago and we're based in the Department of Health. And I think the most important thing is that the government newly elected in 2020 has reconfirmed its commitment to Sláintecare, and in fact our budget for next year has just been massively increased with more than €2 billion being invested in Sláintecare into transformation. And the key principles that all of the government parties have signed up for is delivering the right care in the right place at the right time and given by the right team, promoting health and well-being and preventing illness, bringing the majority of care into the community, and creating an integrated system with healthcare professionals working closely together. Care based on need and not the ability to pay, and having a real focus on not having long waiting times and having a timely service. But at the core of it, our most important and fundamental goal is that the patient experience would be improved. And our vision is that we'll have population-based approach to planning services, clear pathways between general practice, community and social care services with hospitals and within geographical regions. So we're going to be moving to 6 geographical regions and having one budget per region and empowerment of the frontline staff with devolved decision making. We have a phased implementation progress. So our first step over the last year and a half has been to support innovative service delivery and to mainstream those best examples. And they will be mainstreamed through this big budget increase that we have managed to secure from next year onwards to ensure integration and to build extra capacity, but also to foster productivity and creativity. One of our colleagues who's on your agenda today was in Ireland virtually yesterday talking with our eHealth colleagues about all of the things that they are doing in terms of innovation. So it's good to see the cooperation happening there. The integration funds and innovation programs have been dotted all around the country. So you see the little map of Ireland there with red dots where all of these programs have happened. So they were rolled out at the beginning of the year before last, and they were working extremely well. And then of course COVID hit, and many of these projects had to pivot, had to move their projects online, had to change the way they were doing things, and really it showed the creativity and ingenuity that I know healthcare workers all across the world have had to put in place. But the core goal of these innovation projects was to scale and share examples of best practice for people involved with chronic disease management and care of older people, and encourage innovations to shift the care to the community, because we had a lot of people and still have a lot of people who are in hospital who could be treated in alternative situations. We have a learning network developed and an evaluation process around the projects moving into next year. So focusing on the next 3 years, we have 3 priority areas. The first is to keep people well at home or near home, out of hospital and living independent lives. The second is to achieve the waiting list targets. So we've set targets under Sláintecare that people can't be waiting for more than certain numbers of weeks and days to get their analysis and procedures. And we're devising a citizen care master plan to look at how universal healthcare can be rolled out. Healthy living is a key part of what we are about. So this has a big focus on prevention, and there is an established system across government, different departments called Healthy Ireland, which is part of my division in the Department of Health. And we have a focus on the key policies that keep people well in the prevention space. So around obesity, physical activity and national sexual health strategy. And what's interesting about this is that it focuses on the wider determinants of health. So the pieces that are not just simply the health service, so education, housing, water, environment, etc. And we have a very good working relationship with other departments and key agencies all around the country to have a focus on this. We've just started a campaign working with the government, and it was really in response to the pressures that have been felt all around the country in relation to resilience. And it's a programme to focus on healthy minds and healthy bodies with 6 themes. So keeping active, eating well, minding your mood, switching off, keeping in contact, and then with a focus on what's happening locally around the country in cooperation with local authorities and volunteers and people who are out in the system at very local level. Our second focus, as I said, for next year is around enhanced community care. So this is to impact on emergency department reduction of attendance, bed day reduction in hospitals, reduction in referrals, and reduction in waiting lists. So we have invested in 96 community healthcare networks all around the country to focus on especially older people. So we have a program called the Integrated Care Program for Older People, which bridges between the hospital, the GPs and the community and creates a joined up seamless pathway for older people once they have been recognised as being frail or in danger. And other programs include the Chronic Disease Management Program, again, making sure that the pathway is clear to keep people at home for as long as possible. EHealth is a massive enabler of Sláintecare, and never was it more important than during COVID. And I think we've all experienced that right around the world. The importance of remote diagnosis, the importance of e-prescriptions, all of these things, making sure that people could stay away from each other, I suppose, and stay out of the health system as much as possible. We've had very good traction with our COVID tracker app. We've a high adoption rate. It's used around various countries, and indeed with our Greek colleagues today, we have a very good partnership with our colleagues, and today we're hosting an Irish National Interoperability Test event at which Greek National Contact Point team have kindly participated as an international partner. And this is looking at retrieving both patient summary and e-prescription data for an Irish patient to test the service and exchange between both countries. So I'm informed that we have a very good working relationship with our Greek colleagues. So we want to thank you for that very much. Our EHealth Transformation Programme is very ambitious. Again, it has received investment from the government, I think in recognition of the fact of how agile the people involved in eHealth were in the country. It had been underinvested for a long time, but now we are embarking on a system to have national waiting list management, health pathways, e-pharmacy and e-prescribing, residential care management system. I won't call them all out, but you'll be familiar with them all. And we are delighted that we will be working and learning with other partners to see what has happened well in other countries for having these important systems. But I suppose we're trying to focus them in three different areas. First of all, staying well in the community, so systems to enable standardised assessment of home support, residential care management system, GP practice, electronic e-prescribing, and so forth. But by and large, the most important thing that we noticed during COVID was the increased use of telehealth sessions for outpatient departments and moving a reduction of 30% in outpatient appointments because they were now being held online. So huge change in the way of doing things in Ireland. In terms of a person's own health record, so making sure that the citizen is at the centre of this, we will be rolling out the summary care record, shared care record, electronic health record, medications, allergies, immunisation history, and patient portal, clinicians portal. So you'll be familiar with this, but we are embarking on this in Ireland now. And finally, in terms of our eHealth programme, to help our scheduled and unscheduled care systems. So managing capacity and access, integrated care, acute hospital systems management, and scheduled care management. So we have a lot to do, but it's fantastic that what has been shown through COVID and through the cooperation we've had with other partners around the country, that by working together across the system, we can actually make this happen. So I'm delighted to have been able to share our experience with you today, and thank you very much for your invitation.
Laura, thank you very much for such a comprehensive presentation. I think Sláintecare is known to be one of the most comprehensive examples of healthcare transformation in Europe. And one of my first questions would be, how did you manage to get cross-party support for such an important investment that spans through different politicians, different governments, and has an ambition to carry on for a number of years?
It was an amazing thing to have happened, and it happened before my appointment. So it was the politicians themselves who recognised that we were going to be in a crisis if they didn't do something, and they formed a working group. It was chaired by a woman called Roisin Shortall from the Labour Party, but she managed to pull people together from all the parties and to get an agreement on this. And they wrote a strategy, sort of a blueprint for what they thought Sláintecare would be, and they agreed that they needed to set up an implementation office. But it was agreed by government, and I think that is, you're right to point that out. It has been incredibly important. We've now been through 2 electoral cycles since that all-party strategy was agreed, and it was interesting in the run-up to the election this year. There was no argument on health, so every other sector the parties were fighting and debating and crossing each other, but when it came to health, they all just said, "Look, we've agreed to Sláintecare. We're not going to fight about this," and they just moved on. So it was interesting that it has held properly through the election cycle.
I think this is a fantastic achievement that certainly guarantees the sustainability of the program throughout the different electoral cycles, and I think that part of the success of the program is due to not only due to the very comprehensive strategic planning, but also to the agreement of the political parties to support it. The other question, because I haven't got many questions I have a lot of my questions, but I'm trying to see if there are questions on the coming through from the audience. I would like to ask about, there's a strong community focus on the program and how to get patients out of the hospital and allow them to stay healthy independently at home. How that was perceived by the population, and what did you do to make sure that the community is engaged to this initiative?
Well, everybody wants to stay at home as much as possible. Nobody wants to go to hospital. So I think the public are delighted to have services that will keep them well at home. In terms of actually rolling it out, we had very, very strong clinical leadership. So within the Health Service Executive, which is our agency for the country who deliver the services, there was a very strong program called the Clinical Care Programs, and they look at individual pathways. And two of the first ones they looked at, because these were the big users of hospital facilities, were older people and then chronic diseases. So these are the people who can be best treated at home, in their own homes or near to their own home. Now it has involved a large rollout of primary care centres, investment in general practice. So we had to negotiate an agreement with the general practitioners to manage chronic disease actively. And then it involves agreed, joined up referral protocols between general practice, the community teams, and then if somebody needs to go into hospital, how people are referred into hospital and back out again. So it has, all change management involves many, many actors, but I think if you can get people into a room, focus on what the actual problem is, focus on the patient and say, look, what is it that your mum or your dad or your brother or your sister would like to happen if they are unwell? I think people actually park their silos and start looking at the problem in a shared way. So that's what's been managed to have been done. It's not perfect. It's still in development, but it is certainly heading in the right way in an organised way.
And I guess technology must have played a major part into this reform. You already mentioned the use of different devices to help clinicians manage more people at home. That also involves a lot of change management and allowing clinicians to use devices to monitor patients. How did they engage with the whole e-health program we have launched, which is also very exciting?
Well, there was the big driver was COVID, to be honest. When people couldn't come into their general practice, when they didn't need to come into hospital, and hospitals didn't want people coming in case they had COVID or in case they caught COVID. So methods of actually seeing patients remotely had to be brought in really quickly. So as I say, telehealth, teleconferencing, remote consultations, everybody ended up on Zoom. Our General Practitioners Association, we're having meetings every Tuesday with more than 1,000 general practitioners on Zoom calls every week during COVID to learn what was happening, to find out what was going on, and to discuss issues. So everybody suddenly moved, as we are today, everybody suddenly moved to a new way of working. So COVID was the big driver, and we've a lot to do. We don't have a shared care record at the moment, and we don't have electronic healthcare record. We are at the start of this, but there is a recognition and investment that this needs to happen.
Laura, thank you very much. I'll let the organizer inform me if there are any questions from the audience, but on my screen I can't see anything. No. Okay. So allow me to thank you one more time for your time and for kindly accepting our invitation to talk to us today. I think we all learned a lot, and I will be keeping a close eye on this exciting program, which a lot of aspects are similar to what we're doing in Greece. So we'll be keeping a close eye, and I think the collaboration that we have already established between our technical teams can be extended to other issues, because I think Greece and Ireland have a lot of similarities, and smaller countries that have a lot of ambition to evolve their healthcare system. So thank you one more time for your time and sharing your thoughts with us.
It's a pleasure. Thank you very much indeed.